online training and then maybe some face-to-face training. And I'm excited to be supporting that
Yeah,
because
that'd be great. Yeah,
yeah,
so when I finished working at City University, and I was much more then involved with the Margaret Lowenfeld Trust, running the course, but I was also doing clinical work, but just using Sandtray play therapy and Lowenfeld mosaics. But often, because I was working with a colleague who was a speech and language is a speech and language therapist, and her clinic was mainly for provision of services for those kind of
right,
children. She would often, and I'm a speech and language therapist too, she would refer children on to me who needed that sort of more non-verbal approach, who
right,
maybe were showing lots of, well, often they were children with autism,
right.
somewhere along the spectrum or autism, or children with learning difficulties of one kind or another for whom verbal expression was not their primary way of communicating,
Wow.
or they just were very reticent and didn't want to speak, very shy as the little girls, often little girls who were very, very shy and doesn't want to be talking much. And yeah, so that was really worked very well for them. Occasionally, I'd also do sessions with parents and children,
Right.
doing sound trace together, kind of thing, which is great. So
Um,
then that was what I did then, and then yeah, so pretty much then when lockdown came, I sort of decided to retire.
wow. And then you packed up your miniatures,
I gave them away, yeah.
did you?
Well, I left them in the clinics actually, because some of the therapists like to use them,
Right.
um, even if they were, if they hadn't been trained. But actually they got a play therapist in the clinic where I was working, so I left her my stuff that she could use as she.
Wow, she must have felt so grateful.
It was hard to leave the objects all behind, actually.
I was gonna say, I appreciate what that's like because I've thought about that when the time comes when I retire. It would be, I wouldn't want to be selling them. I would want to like donate them and know that they're going to be well used.
Well, that's why I just thought the best thing is to leave them there, and people will use them as they wish, and hopefully they will use them correctly.
Yeah, that's the question, isn't it? Can you remember, is there one miniature that stands out for you in your career that that was hard to say goodbye to?
Not really.
No,
It's all of them, really. I
all of
just
them
had a
really.
whole lot that I really liked. Lots of things. Yeah.
Well, my training was with Dr. Gisela Di Domenico out of California, and she would always say that each miniature was like when we're having miniatures in our office, we're creating uh, a container of experiences. So
Mm.
every miniature has not just words, but there's an experience connected to it, and it's so true. When you say all of them, I totally appreciate that. I was at my team members had one of them had a barbecue, and they had a cake, and on the cake she put a little lighthouse, which is on the logo of my company, and she said, "And you get to keep that." I was like, "Oh, thank you so much. I'm going to put it in the sand tray on the sand tray shelves," and they all laughed. They were like, "Of course you're going to do that." Because you always look at the world from when you're using Sandtray as a modality. Everything you're looking at like I don't know if that's you, but for me, I was in a restaurant in England a couple years ago, and there was a Jewish couple there, and they were eating kosher, and the restaurant had the salt and pepper shaker wrapped in saran wrap for them, like ahead of
Okay.
time.
Yeah.
And then she finished it, and she knew we'd been talking before, so she knew I was a play therapist. And afterwards she said, "Would you like to take those with you?" And I was like,
Ah,
"Yes, I would, thank you." And she said, "I thought you would. They're just going to throw them out, and I'm not taking them with me." So I said, "Thank you." And then I always say on the plane home, um, from England, the waitress, people get little alcohol bottles. And
yeah.
I said, could I have that bottle? And she was like, "Well, I'll give you a full one if you want." I was like, "No, no, no, I just want the bottle."
It's not for the drink, it's for the bottle.
And she said, "Why?" And I said, and I explained, and she said, "So you have those in your office?" And I said, "Yeah, because they're miniature alcohol bottles." And like, you just look at the world differently when you're a sanitary therapist, I think.
But
Everything is,
the other thing is it's so important if you have all of the things together, and you're seeing children that nothing gets lost
Yes.
because the kids notice
Yes, they do.
and they may knit. I mean, I always remember terrible because I left all my stuff at the clinic, and I always put it. I had a cabinet with drawers that you could pull out that had
Yes.
contained all the toys and items, not all toys, obviously, stones, fences, rocks, whatever it might be. And one day, this was one of the children I was working with, and she said, "Where's the Anna figure from Frozen?" And it had been there the week before. She
Right.
really strongly identified with this person. She was gone.
Oh, she
Someone had
travels
stolen it or taken it,
or
stolen it. It had
travels. I
gone.
always say it travels. They travel.
It traveled. Someone wanted it very badly, evidently.
Yeah.
And that was awful. She was really bereft. But then you just have to work through that whole thing of not having the thing and all of that. So you can do that, but it's a shame when they're not able to have that and they feel as though they've been displaced.
Yes. Well, and I mean, we could even have a separate video just on miniatures, in terms of how they're shown and shared. And I mean, the standard picture that gets shared of Dr. Lowenfeld is her sitting beside a little girl in a Sandtray,
Yeah.
and the Wonder Box is behind her. Um, and I always share that picture with students, and we talk about there's some therapists that are very adamant things need to look a certain way.
Hmm.
And I always say to students, you have to find the way to share the miniatures that fits for the population you're working with, because you could be
Yeah,
working with little people who get flooded by seeing all the miniatures. Maybe they have,
definitely. Yeah.
you know, for whatever reason. And some people, like you described, put miniatures in drawers. I know throughout my career, the first office I had a coffee table from IKEA that had little baskets underneath it, and there was probably 24 baskets. So
All
I
right.
put miniatures in each of the baskets and then a
Yeah.
little picture of what was in the baskets, so that they could find them. And then the sand tray was on top of the table. And that worked okay, right up to having shelving like you have behind you with
Mm.
miniatures on different shelves. And I know with some methods like the Erica method that you hear about, that I'm not trained in, because it's very much assessment. There's a real priority on having miniatures exactly, certain miniatures on certain shelves. That's, number 1, 2, 3, 4, 5.
Okay.
And I've found it, I don't know,
Is
I
that
found,
for a coding reason or they
I
need
think
to?
it's for coding. And but I think, like, when students ask me how should I do it, I was like, think about who's coming to see you and what's going to be most easy for them, and
Yeah.
then that's how you can set your shelves up. But you're right. Children notice when things have gone missing, and it's important to have predictability for them of
Yeah.
where things are.
Or you
Uh,
have to deal with the issue if it's not predictable. I mean, that's obviously an issue for a lot of people. So,
well,
I
in a
mean, you
clinic when there's so
you
many
can have
people
this,
coming in, yeah, like
you
if you have different
can, I
therapists.
mean, I've had to do that a few times with things going missing and yeah. So,
Well, Sue Bratton, who was a professor at University of North Texas and is really known in North America for in the child-centered world, she talked about when they set up their clinic at that university, and it's kind of cool the way they did it. They labeled the shelves like A, B, C, D, and then labeled the miniatures by number and put a sticker on the bottom of the miniature that would say like
well,
A5, and then there'd be a corresponding sticker A5 on the shelf. And then
put it there.
whatever condition was in there would know where to put the miniature, right? And I was like, wow, that's like so organized.
Not me. I can't do
Yeah,
that kind of thing.
I couldn't do it either, but I'm in awe of it. But I think you have to find your way. And the
Yeah.
other thing you mentioned when you mentioned Frozen, it made me smile too, because um, I have been in training where the trainer has said, you may not want to have too much pop culture miniatures. And my argument to that is, but if that's the culture of the builder,
Yeah.
then that's okay. Like,
I
so we
agree.
kind of know who they are and what's going to help them communicate whatever experience they have.
Completely, because they identify with a certain character or
Right.
an aspect of that character or a feeling that character gives them when they've seen them in the movie. So they've
Absolutely.
seen the movie. I mean, this is all get about thinking about how feelings are represented in the brain. That feeling
Right.
is what they want to represent, and that person may represent that feeling for that person. So I don't think it matters if it's a Disney character
Yeah,
or
I
whatever.
agree.
I absolutely don't think it matters.
But so important to try and have miniatures, like be cognizant of what the culture is, or even I've had the I think of a little girl that came in to my office that was Jewish, and there was no Jewish temple nearby, so there wasn't a big Jewish community. But for her to come into my office and see a miniature of a rabbi holding a Torah, that like she was like, "Can I bring my bubba?" And I was like, "What's a bubba, honey?" And she said, "My grandmother." And I said, "Of
Yeah,
course." So she had to bring her to the next appointment to show, see, look.
over that. Yeah.
Yeah, just to have a part of your identity reflected is so important for like I for a student. And I always say to them, you're not collecting, you're selecting, but you're doing it with intention
Mm.
around who's going to visit the room.
Allowing expressiveness for everybody. And I
Right.
think if you're saying you're going to have branded characters, whatever, you also need less unbranded, more
Yes.
generic things that people can identify with: a leaf, a field, a gate, a
A
horse.
rock. Yeah,
Yeah, anything that isn't labeled Pegasus, or you know what I mean. So you want
absolutely.
things that don't have that characteristic as well, so they can project their thoughts and feelings onto something that's not already labeled as something. And I guess people don't want labeled things for that reason,
Yes.
because oh, that person represents sadness or that, you
Right.
know. But on the other hand, you can, if it rings a bell with a person, then it's fine. But it can't
Absolutely.
be the only thing. It
No.
is the Disney character or whatever can't be the only thing you have of that. A horse
You
or